Now, up next, we are talking about what is known as the esophageal dysmotility. So, when I hit up with a question like this, I always want you guys to always discuss terminologies. Alright, just try to make sense out of the main words there. So, when you say esophageal, of course, you are talking about the esophagus. When you say motility, is movement. Okay, so when you say dysmotility, just simply means that the normal movement that used to occur there is no longer moving as it should. Do you understand? So let's talk about it. Esophageal dysmotility just refers to a group of disorders, so it's not really a single issue. All right, but generally, one thing that is common among these disorders is what the esophagus is failing to move food and liquids down to the stomach. So they are hooking, do you understand, and all of that. So it causes issues like difficulties in swallowing, chest pains, heartburn, and the rest of it. Right? That's just on introduction. So full definition is an abnormal movement of the esophagus due to impaired muscle contractions. So the problem could be in the muscles, the problem could be in the nerves. All right. So normal physiology says that there's coordinated movement. So usually when there's coordinated movement around the esophagus, that's what usually pushes food down. Okay. So but when this movement is weak, uncoordinated, or absent, food happens to be hanging around that region. Okay. So you are coughing, you are vomiting, a lot of it. So causes could be due to the lower esophageal sphincter. It is not relaxing. So as food come here, there's no relaxation. So for the food to go in, there's the issue. It could be spasms. The muscles are just uncoordinating, just moving. Do you understand? There could be a nutcracker esophagus. So secondary causes could be due to scleroderma, gastroesophageal reflux disease, Parkinson's disease, stroke. We are just having issues with, the nerves and all of that. So that's it. And side effects of some drugs that what the patient is currently taking. So symptoms is difficulties in swallowing, chest pains, or discomfort, heartburn and reflux, regurgitation of undigested food, then sensation of food sticking in the throat or chest. Then because you are not eating well, you might actually now be losing weight. You understand? So you diagnose it with esophageal manometry, barium swallows, and endoscopy. You treat it with sometimes lifestyle. So sometimes the amount of food the person is eating, they have to reduce it for the meantime. Then if you want to involve drugs, you can now use all those nitrates or calcium channel blockers, proton pump inhibitors. You can also do surgeries like endoscopy balloon dilations. You can also give injections to relax muscles like the botulinum injections. Also other surgeries like the Heller's myotomy. Okay, so that's what we have for esophageal dysmotility.